Hi, YouTube. Welcome back to my channel. My name is Dr. Daniel Kaplan, and my mission is to make psychology accessible to all. In today's video, we're going to talk about the family. We're going to talk about the child-family relationship. We'll talk about some social factors that influence the developing child as potential risk or protective factors for psychological illness. And then we'll talk a little bit about culture. So without further ado, let's get into it. So if we were to talk about the social factors or environmental factors, we have to be mindful of both proximal and distal events. Proximal events are close by, whereas distal events, you're further removed from the situation. So let's say a child is born around the time of, I don't know, 9/11. Their experience is going to be different as a function of that than someone born the same time period, but in Nebraska, right? Because you're closer to the event. And obviously, the older the child, the more impactful that event will be because they'll remember it. But when we think of environmental factors, we have to pay attention to both shared and non-shared environmental factors. So a shared environmental factor is a factor that produces similar developmental outcomes among siblings in the same family. Whereas a non-shared environmental factor are environmental factors that produce differences among siblings. So non-shared means differences in this context among siblings in the family. One of the models that connects the child and the family to the larger society is Uri Bronfenbrenner's ecological systems model. And in Uri Bronfenbrenner's system, he talks about the concept of a microsystem, micro being small scale. These are your close units. This might be your family. It could be your daycare center and so forth. We have a mesosystem. The mesosystem would be the system that connects the family with the school, or the family with the neighborhood, or the family with the peers. So the mesosystem is the interconnection of several microsystems. Then we have the concept of an exosystem, exo being outer, like the exit sign is to leave or to go out. So an exosystem is a more outer system. And when we get to the exosystem, we're going to say that this system does not have direct contact with the child, but can impact the child's development. For example, in the exosystem, you might have a parent's place of work. And if you think of a parent's place of work, typically children are not there on a regular basis. So you're not going to have a direct influence by a parent's workplace. However, if a parent is in a stressful work environment, they could bring that home with them. And indirectly, it can affect the development of the child or the family as well. You also might have, if a parent is laid off from their place of employment, well, that financial stress could impact the child, or the lack of financial resources could impact the child. So when we get to the exosystem, it is more outer, more disconnected from the child. And then we have the macro system. The macro system is the large scale values, customs, and laws of the society. So what are some of the values linked to being born and raised in the United States? Well, we could say that there is a strong emphasis on patriotism. There is a strong emphasis on individuality, strong emphasis on pulling yourself up by your bootstraps, and so forth. So uh, there's a strong emphasis on you standing on your own 2 feet. So a lot of this is that, and we would describe the United States as more of an individualistic society, whereas other parts of the world, the value system, customs, laws are different. So in a collectivistic society, some of those very same attributes could be viewed negatively. So if you're standing on your own 2 feet to the exclusion of looking after the family, that could be dishonorable. If you're focusing on your individual pursuits and it causes some level of absenteeism or not taking care of the family or being an upright member of the community, that would be shunnable. So there's more of an interdependence in collectivistic society. So Uri Brunfenbrenner understood that. So he talked about the macro system as well. What's not depicted on this picture on the right is the concept of a chronosystem. And the chronosystem refers to time. Being born in a certain time period also affects us. So the values of a person being born in the 1920s are not likely to be the same values as a person being born in the 1960s or 70s, and certainly not the same as someone being born in the 90s or 2000s. There is a shift that happened in each of these decades, which could alter the value system. So the child is developing in an environment, but is also influenced by the zeitgeist. And the zeitgeist is just a fancy way of saying the spirit of the times, whether they be social or political. So let's talk about attachment. I mentioned that attachment is essential in helping children develop that emotional bond. So we talked about emotions, right? And we talked about a child being comforted and having less emotional reactivity if they have a strong emotional bond with their caregiver. So by definition, as you can see, it is a strong emotional bond with a parent or caregiver, right? Versus we talk about another form of a bond, a romantic bond, which we talk about intimacy. In a romantic sense is also a strong emotional bond, but that's not with a parent as much as with a romantic partner. But let's talk about attachment. If we were to think about attachment, there are 4 patterns of attachment. There is a secure attachment in which the child functions relatively well. They can cope with their environment and so forth. And I guess I should talk about the strange room experiment because the rest of this won't make sense otherwise. So the strange room experiment was where a researcher had infants and their caregiver in a playroom. And while the caregiver was playing with the child, a stranger enters the room. Now, there is a normal reaction called stranger anxiety. So we expect there to be some sense of nervousness, apprehension, or discomfort when a stranger enters the room. The stranger then makes their way closer and closer to the parent and child or the caregiver and child, and then starts to talk to the parent or caregiver. The caregiver or parent eventually gets up and leaves. Now, when that caregiver gets up and leaves, that should induce another emotional reaction called separation anxiety. So there's an anxiety that is induced by this experiment. And then ultimately, the parent or caregiver returns and approaches the child, and then the stranger leaves. That's kind of the sequence in a nutshell. When we look at attachment, we expect moderate levels of distress when the parent leaves, but we also expect the child to feel comforted and safe and secure when the parent returns. So a secure child or secure attachment, this child is going to, be bothered by the parents or leaving and comforted by them returning. Then we have something called an insecure slash anxious avoidant. Now, this child has minimal distress when the parent or caregiver leaves and is equally not comforted by the parents returning or caregivers returning. Now, that's important because if I were to describe this person plays minimal role in attachment. There might be some level of apathy to the parent leaving and lack of comfort to them returning. Whereas in similarly, another insecure pattern we have is anxious resistant. And in anxious resistant, it's the opposite. I said that even in a secure attachment, there should be some level of distress, moderate levels of distress. Well, in an anxious resistant attachment, the child has strong or severe levels of distress by the caregiver leaving. When the caregiver returns, one of the differentiation points as well is that the child, not only does the child avoid or not seek out the caregiver, but if the caregiver tries to comfort the child will resist. They might push the caregiver away. They might bite the caregiver. They might kick the caregiver, and so forth. And then the last of the four patterns of attachment is something which we call disorganized or disoriented attachment. And this is where the child does not have a predictable pattern. So it doesn't fit nicely into any of the previous three. Now, outside of this secure attachment, all of the insecure and disorganized attachments, well, guess what? They are linked to childhood disorders. And we'll talk about attachment as we look at each of the disorders, and it'll make more sense. So we talked about attachment, we talked about parenting, we talked a little bit about shared experiences, and I want to talk about family systems. A system are a group of people that are part of a unit. Now, a family system, it allows us to understand how the family works, right? So family systems models focus on things like communication within the family, focuses on power struggles within the family, conflict, and so forth. We understand that dysregulation in part of the family system is going to affect other parts of the system. We also understand that healing in one part of the family system is going to have a carryover effect on others. Now, when it comes to childhood psychopathology and the treatment of mental illness amongst children, we have to understand that children are not alone. They cannot do it on their own, and it is important that the child not be treated individually or separate from the family. You can and should enlist other members of the family to help the child progress. Let's take a case of a childhood eating disorder. Well, a childhood eating disorder might come from a perfectionistic parent, overly critical parent, a parent who comments a lot on a child's weight. But that same parent in therapy, we could talk about these issues and modify them, as well as we could make sure that food choices are corrected. So, in the case of obesity, children rarely buy their own food. The parents are buying the food. So, we can even talk about, hey, what are the food choices you're making in the supermarket? So, we're going to include the rest of the family as part of the system. And it's very, very helpful. So we treat the family as a unit, and you deal with both typical or healthy behaviors and atypical stressors. And that is how we view the peers, the family, and the larger community. So that is what I have for you for social factors and how they influence development. If you found this video meaningful, hit the like button, consider subscribing to my channel. Also hit the notifications tab. That'll let you know when I release the next video. And also, if there was anything that stood out, write it in the comment. I read and respond to every comment. I hope this was useful. But until next time, take care, everybody.